making one.
Hi, my name is Julia Bass and I'm author of Your Care Plan, A Nurse's Guide to Healthy Living. I'd like to share with you a summary of an event I went to in November of 2010, which was put on by American Heart Association and Nintendo's Wii Active Games. During the day there was an expert panel and the people who came were able to ask questions. So we're going to give you some of the key points that were raised during the day here on this video. I'd first of all like to introduce some of the other panel members. The first was Dr. Matt Devane, who is a cardiologist.
Matt Devane, I'm a cardiologist. I work in the East Bay and I'm on the board of directors of the American Heart Association. And my dad had his first heart attack at 35 and bypass, second heart attack at 45 with another bypass, and third at 55, and he died afterwards. So I've been committed to heart disease prevention. I will want to say that I'm on call this weekend. I started rounding at 5:30 this morning so I could be here, and I was really questioning if it was going to be worth my time, but listening to Hank talk up front is already worth my while, so I'm glad to be here.
Our second panel member was Nicola Tate, who is a pediatrician.
My name is Nicola Tate. I'm a pediatric cardiologist at the California Pacific Medical Center. And actually, I did my training in internal medicine and pediatrics and pediatric cardiology. And most of my work with the American Heart has previously been with children with structural heart problems and adults with congenital heart disease. But clearly, there's been even the time since I graduated from medical school and coming on through my training, ever-increasing concern about the heart health of children, not just for the ones that get referred for arrhythmias or heart murmurs, but I'm getting more and more referrals from pediatricians for children with high body mass indexes and hypertension, and it's clear that this is a huge problem, and I think any information that we can give to children as either parents, brothers, sisters, aunts, uncles will and to set them on the right course is going to be the most important thing. As I tell some of the children that come through my clinic, where I try to talk to them about cholesterol and hypertension and risks for coronary artery disease, I say, the hospitals are full of people with heart disease and we're not doing a very good job curing them. So we really have to prevent it, and it's with the young children that we have to prevent it. And so I really appreciate that the American Heart Association has also taken children under their wings as a risk a group to try to modify risk factors.
Our third panel member is Lisa Blanton, who is a wellness coach.
Hi, my name is Lisa Blanton, and I am here to talk to you about an actual case study of someone who went and changed their lifestyle. So, unfortunately, mine started because I was in Crescent. Heart Association has something called the Start Walk, and through that organization, there was a nomination for something called the Lifestyle Change Award. The presentation needs to be devoted to a man named John Stantos. John Stantos was my brother's best friend. And in September of this year, he died of a massive heart attack at 44 years old. And he left behind his wife, Denise, and two small kids that are 4 and 2. And they unfortunately had to witness this massive heart attack at his home. But my brother could have lost his sister 2.5 years ago. So 2.5 years ago, I weighed 250. So I fit into these jeans. Okay? And I was stressed out, and I was I'd worked for my company for 22 years, and now I own 25% of it, and things weren't going so well with the economy, and I was eating too much, not moving, I had no energy. On really stressful days, I would leave work and drive by McDonald's and stop and get one of those supersized meals. And I would go to a park and eat that meal, throw away all the trash, roll down the windows, chew some gum, drive home. Meet my family. He cooks for me. I would have dinner with them. Be so exhausted, we just watch TV, and I'm like full belly, and I'm just, feeding my emotions with food, and go to bed by 9 o'clock, just enough energy to get up to go back to work. One day at work, like August 25th, 2008, I thought I was having a heart attack. Shortness of breath, chest pain, called the doctor, they said get in right away. I was already hypertensive and I was pre-diabetic. And she had already lectured me about how I'm supposed to change my lifestyle. Yeah, I'll get to that one. I was put on a medical leave from work for 30 days. And during those 30 days, I assessed my situation. I do have a daughter. At the time she was 12, and my husband, and I said, this is not how I want to live. This is not how I want to live my life at 44 years old at that time, and done.
I was the fourth panel member. Well, my name is Julia Bass, and I'm a nurse, and I wrote a book because I would visit hospitals and be around my colleagues and realize they were facing the same issues as we all face around trying to be healthy, and yet they were experts. They had all the knowledge. So what is the key between turning your knowledge into your behavior? And some of that has to do with the way you think about things, and some of it has to do with having a great environment that will support your behaviors. So we're lucky because we live in the Bay Area and we have great fresh vegetables year-round everywhere, and we can go outside and exercise. But that was my motivation and why I'm here, because I, like everyone else, believe prevention is so important. And I'd also like to introduce our host for the day and our panel moderator, Hank Wozniak.
Thanks a lot for having me here. My name is Hank. I'm a 7.9. I'm a 7.9 because, for two reasons. One reason, thanks to a lot of great work by the American Heart Association, I take cholesterol medication, and I also take blood pressure medication because I got my numbers checked. But I'm not up higher because I've never met a dessert I didn't like, and then I have sugar issues, and I don't exercise enough. So that's my goal, is what I'm trying to do. And the theme of this session is get empowered, get informed, and get active. So hopefully that's what will send you away here today. And it's about behavior change. Natalie said we've been touring around the country, but as they say, if you can tell, I'm from New York, and in New York we say behavior change ain't easy. It just isn't. Things have got to move in different directions. So you need all the help you can get. So and the American Heart Association, when we saw the opportunity with Nintendo, we said, hey, this makes some sense for us, because what we can do is put our resources together. So you go now to the American Heart Association website, and it's not lots of reports, it's tools and techniques you can use, like the Simple 7. And Nintendo teamed up with us because we have a way to hopefully get people active and out. When you look at the Simple 7, there's 7 things. Get active, lose weight if you have to, eat healthy, get your numbers checked. I cannot take, no matter what age you are, get your numbers checked. Cholesterol, blood pressure, blood sugar, and stop smoking.
I'm going to review with you Life's Simple 7, which are the 7 steps you can take for optimal heart health. The number one thing you can do for your health is to avoid tobacco smoke, and if you do smoke, to quit. The number 2 thing you can do for yourself is to maintain a healthy weight, and that means having a BMI of 25 or lower. The 3rd thing you can do is to be active, and the Heart Association recommends at least 150 minutes of moderate intensity exercise every week. The 4th thing you can do is to eat a healthy diet, and that means lots of fresh fruits and vegetables and avoiding processed foods. The 5th thing you can do is to know your cholesterol numbers, and your cholesterol should be, your total cholesterol should be 200 or lower. And from the age of 20, you should have that level checked every 5 years. The sixth thing you can do is to know what your blood pressure is and have a normal blood pressure, which would be 120 over 80 or lower. And the seventh thing you can do to look after your heart health is to know your blood sugar, your fasting blood sugar levels, and your fasting blood sugar should be below 100. So having reviewed Life Simple 7, let's go to our panel and see what some of the questions were that came up. So the first question is, how does exercise with the Wii compare with regular exercise?
Well, a lot of people ask me if they can use heart rate as a gauge to whether a workout is going to be effective enough. And it's very hard because it's so dependent on what kind of shape you're in to begin with versus someone who's not shaped and overweight. The heart rate goes up immediately and it takes forever to recover versus if you're in shape. You know, the American Heart Association typically recommends moderate intensity exercise, which means you shouldn't be able to kind of hold a conversation, or you should at least feel it during your workout. You know, you should be panting. So you kind of get a feel from that standpoint rather than the heart rate, and then it just depends on the time. You know, they recommend 30 to 45 minutes, 5 or more days a week, so it just depends on how long you're doing it, how much of a workout it is for you, and if you really have a track record of heart rates, it may be useful, but it's really more how you're feeling, how you're breathing, and how long you sustain it. So it certainly can be an adequate workout. Most of them probably aren't.
I went to a party where it was a Wii party, and so instead of just sitting around like eating potato chips, we were playing Wii games. So there's, you know, that wasn't our whole exercise routine for the week, but it was a great way to make a normally sedentary activity have some activity in it. And the next question is, why is this generation expected to have a shorter lifespan than their parents?
I think it's quite multifactorial. I think that there are, you know,